everyone, and welcome to another episode of Tiny Matters with Dr. K. Today, we're talking about something that every single parent has done. Your child develops a symptom, a rash, a fever, or maybe a strange cough. You whip out your phone and you type in the symptoms. My child has a rash. Simple. Next thing, you're reading about meningitis, rare autoimmune diseases, and all sorts of life-threatening conditions you never fathomed your child could have. By the time you close your browser, you're terrified. Today, we're talking about what happens when parents search symptoms online, why it can be both helpful and harmful, and how to approach online medical information in a way that actually supports good decisions. So why do we search for information online? Let's start with something important. Parents search online because we deeply care about what is happening with our children. You want to understand what's happening, and you want reassurance. You want to know if it's something you can manage at home, or if you need to run to the hospital. Access to information is not a bad thing. In fact, we have access to information like never before. But the internet was never meant to triage clinical symptoms the way doctors do, and that's a big part of the problem. When doctors assess a child, we don't just look at one symptom. We assess patterns. We consider age, duration of symptoms, associated signs, behavior and energy levels, vital signs, as well as examination findings. But when we search online, you're often entering just one symptom. The problem with the internet is it will show every possible cause, from the very common to the extremely rare. So a simple viral rash may appear on the same list as a life-threatening illness, not because they're equally likely, but because search engines aren't trained to weigh clinical probability the way doctors do. Another challenge with online symptom searches is what we call availability bias. Our brains are trained to look for the most frightening, most dramatic scenario. When you see a list of causes, your mind is probably going to jump to the worst one. In medicine, probability matters. For example, if your child has a rash and a runny nose, it is more likely to be a viral illness. For example, a child with a runny nose and a mild rash is more likely to be a mild viral illness than a life-threatening disease. Doctors are trained to think of common things first and rare things later. The internet doesn't always do that. Now, I want to be fair here. The internet can actually be really helpful. It can help parents think about normal childhood illnesses, recognize warning and danger signs, understand when to seek medical help, and prepare questions for when you ultimately go and see the doctor. So access to information can actually be quite an empowering tool. The key is how that information is interpreted. One of the biggest challenges today is the amount of medical misinformation online. Social media platforms often prioritize engaging content rather than clinically accurate content. This means dramatic, emotional, and controversial posts spread faster than balanced medical information. So parents may encounter exaggerated claims, anecdotal stories presented as facts, misleading natural cures, and incorrect interpretation of symptoms. Unfortunately, where your child's health is concerned, medical misinformation can often lead to unnecessary anxiety and incorrect medical decisions. As a doctor, when I evaluate your child's symptoms, I tend to ask a series of structured questions. For example, when did the symptoms start? Have the symptoms changed over time? Is your child eating, playing? And are there other symptoms that accompany it? These questions help me to build what we call a clinical picture. It's not just about the symptom, it's about the context around the symptom. So if you're a parent, and let's be honest, most of us are going to Google symptoms at one point. What is the best way to access online health information for your child? A few simple principles can help. Number 1, look for credible sources. Reputable medical institutions, pediatric associations, and academic hospitals are far more reliable than anonymous forums. Second, avoid reading lists of diagnoses without clinical context. Remember, rare diseases are called rare for a reason. Thirdly, pay attention to red flag symptoms. These include things like difficulty breathing, lethargy or weakness, persistent vomiting, seizures, dehydration, or a child who simply looks unwell. These are the signs that matter most. The one thing we don't discuss enough is the emotional impact of searching symptoms online. Late night symptom searching can quickly spiral into a frenzy of anxiety. And once that anxiety takes hold, it becomes very difficult to interpret information calmly. Sometimes the most helpful step isn't another search. Sometimes it's reaching out to a trusted healthcare provider who can look at the whole picture. The internet has certainly changed the way that we access medical information. And while that access can be empowering, it can also be dangerous in the wrong hands. Symptoms rarely exist in isolation. They exist in the context of the child's age, medical history, behavior, and physical examination. So while online searches can offer possibilities, clinical judgment brings clarity. Thank you for joining me for another episode of Tiny Matters with Dr. K. If you are a parent that has found yourself searching for symptoms online in the middle of the night, you are not alone. The goal isn't to avoid information. It is to approach it with perspective. So instead of Dr. ChatGPT, let's try our GP. Until next time, stay kind and stay curious.